What cautions do I need? I request Dr. Dhaval Patel sir to introduce the moderator.
Hello. I would like to introduce Dr. Ugit Thakur. He is qualified MBBS and MD Internal Medicine. He did his IDCCM from Jaslok Hospital, Mumbai. His affiliation is the Secure ICU and Specialty Hospital in Vadodara. He is Director and Chief Intensivist in Parul Sevasram Hospital and Medical College. He is a Senior Intensivist. His area of expertise in the telemedicine in ICU, ventilation and strategy, as well as diagnostic challenges in ICU. Today, his topic is My Hospital is adopting a new electronic record system. What caution I need? Thank you, sir. Now you can proceed, sir.
Thank you very much. My panelists are Dr. Amit Patel from Rajkot, Dr. Samir Patel sir from Karamsad, and Dr. Krunal Patel from Surat. So without wasting much time, there is something different in this topic. Let's understand that first. There is no ICU in this topic. It's a critical care conference. So is it worthy? And there is no option to not opt the digital system. The topic is we are already going ahead. What cautions should I take? There is no textbook reference. The literature is not significant and not comparable sometimes. And it's basically an experience-based structured customization is the only option. The topics make you think beyond the ordinary boundaries of what we do regularly, and it's 100% original content and discussion. There is no disclosure. One change in the topic is it should be a digital record and not electric record. As we know, the hair dryer or the iron with which we press the clothes is electrical, but it is not digital. So the correct word will be the digital record. It's a gray area between healthcare and info technology. So like a lion god, it's not from the medicine, but it's not from the information technology as well, because we are using it, we are the doctors. It's not a drug, but still many lives depends on it. It's a topic which not including CPR, but everyone has to learn it. And it's not adrenaline, but you will get an adrenaline spike if the digital record system of your hospital is not working properly. It's not life-saving per se, like in true words, but it's still worth discussing in a critical care conference. Let's see. It can make you either hero or zero. Yesterday in skit also, which was done by my colleagues from the Vadodara city, it was very well mentioned by the medico-legal expert that which is not written, it's considered not done. So all documentation depends on this digital system which your hospital is adopting, okay? So this is very clear. We are not confusing it with HMIS. HMIS is Hospital Management Information System. We are not discussing this. We are discussing digital medical records. HMIS manages store, pharmacy, finances, billing, cash flow, attendance, salary, and it is not dealing with patients' day-to-day life and functioning of the ICU. Here we are discussing this. It is medical records and it is very important. Okay. So from where to start our case? There is no history, sign, symptom, treatment. So let's do it a non-medical way. We'll start with fundamental questions. Who, how, when, why, where, and what. So we'll try to dissect it out. First of all, how? We'll like to ask we'll start the ball rolling with the discussion that how we should implement the digital medical record system in our hospital.
How to start?
How to implement the digital medical record? Like what softwares we can include, or should we make a new one or start use existing?
Okay, I think in every hospital has a unique structure, unique way of working, writing, documenting, or even a prescription, whether you want to go for OPD base or indoor also. I am working in a medical college. We have electronic medical system, but to implement it, rather difficult it is. Regarding the software, I think you can, if you have IT team, very good IT team, your own hospital can make it. That is very convenient for all because they know the working pattern and everything, or you can buy the outside or outsources. That is either way you can do it.
Yes, Dr. Krunal.
The thing is, when we adapt, software is already made. That is actually, in the cost wise, it is cheap.
Yes.
When we develop our own software, yeah, it is customized by your own self, but it is a bit costly and it will take a long time to develop. So if you buy a already made software and customize that software according to your field or according to your requirement, that will, I think, the midway to go. If your IT team is very strong and they will give you time, and as sir says that they have the medical college and they are developing their own software, that is possible. But when you think about in private hospitals or corporate structure, where the things are a bit different.
Sure. So now the next question, when we have to change? The change is the only constant. I'll just show you a small video. If audio is not there, it's okay. This is a Mentos commercial in which the donkey and monkey are going through an forest. The monkey eats Mentos obviously, and then he starts adapting. He changes his stance from to standing one. He hunts the deer and make clothes for him, and then he adapts to start the fire. Then he went ahead and invents will, and ultimately he is a better person now. And when he comes back to the donkey who is still resting, he can rule over the donkey. So basically the message is that we have already lost the race. According to the panelist, when should we implement digital medical records into our hospital?
I think sooner is better.
Yeah.
Like, I remember then there was a time when we were very skeptical to switch over to auto cars. Like, I myself was very used to with manual car, and we were very restrained to use auto cars. And now the time has come when the auto cars have changed, almost the manual cars. So, like you said that already we are late. So sooner would be better. As soon as we start using it, we'll be able to get adapted it sooner, and I think that can change overall scenario for us in our day-to-day practice.
Definitely. Now, why? Why should we change over to a digital medical record system? If we need to evaluate a digital medical record system, the first thing is why. Does it improve our profitability? Does it improve our ease of functioning? Does it improve our reliability, efficiency, and others? To discuss this, we have structured it into 4 different ways. But first of all is the question, do you know this gentleman? I will tell his name is Benjamin Parker. Ben Parker? No? No one? Now do you remember him?
Sean Parker.
He's Spider-Man's uncle, okay? And what message he gave to Spider-Man when he came to know that he got a superpower is, with great power comes great responsibility, and he dies immediately after. So these were his last words. Similarly, our digital record system has to be responsible. The power to manage healthcare records comes with responsibility. So we'll dissect it out in 4 different things and 4 discussions: reliability, flexibility, efficiency, and affordability. First of all, we have to see reliability. Malfunctioning of medical record system can cause data loss, which is having legal as well as day-to-day working implementations. We'll start the discussion straight away. How will you evaluate the reliability of a medical record system?
I think digital records are, in terms of storing the data, is more reliable than a pen and paper. Because in the legal term, if you go legally, OPD and OPD and indoor cases has to be stored, even especially the medical records, should be for 10 years. Paper-based, to store it, having a department, medical record department, to preserve all the paper, it's a little bit cumbersome.
Definitely.
But digital one, I think it is very helpful, and you can easily access also, retrieve also whenever it is required in the same format.
Sure. Any other comment?
See, storing is easy, but the problem, when you store a physical record, you need a space. You have to take care of the water, you have to take care of the dust, you have to take care of the paste control regularly, and as the requirement is there, at least 5 years you have to store the data. In case of digital record, you can store in a drive, or you can even store in the cloud also. So from where you can retrieve. Yeah, there are thefts.
Yeah.
There are thefts. We cannot say, even if Instagram and such things, such digital softwares, if they get hacked, so your data can be hacked. That is possible. But yes, we have to ensure that we have to take some legal notifications or legal documentation for there also. So that is required.
So,
Also, since these all digital records is dependent on either a software or a device through which we are storing it to the cloud or hard disk or anything, and of course it is dependent on internet, any Wi-Fi or these things. So we have to ensure that there is a system which will ensure the robust internet or Wi-Fi or the device failure, or we have to have some backup in case of such software or internet related errors.
so the basically conclusion is, if we lose data, we are losing lives. So what we need to do, we need to have a robot backup system. The offline saving in the tablet if net is not available, so that we don't lose the data when we are generating it. Lifetime records backed up on the cloud, and local backup if the cloud is not accessible by internet. All three things, and to prevent hacking firewall. These all things are mandatory. Now we'll go to the next topic, our digital documentation system. After checking its reliability, we are checking its efficiency. It has to be multitasker. What it can do, how efficient we can make our digital record system.
Of course, like with paperwork and all, we have a lot of other headaches, but with this, like, even our radiologists are, reporting the X-ray films and CT scan through, visualizing it digitally. So nowadays we can have, with the digital record, the X-ray films and CT scan in a device from where only we can read it, rather than, visualizing the films and everything.
Even you can say that all digital video you can record of counseling, you can store the screenshots of any injuries, or so that at the point of such a medical legal case and all, at that point of time you have available all these files digitally with you whenever you required.
Definitely.
And along with that, nowadays even radiology department is more or less becoming more digital. So you have to follow the same, and giving report is ready. But as Wardboy is not free, so you didn't get a report. That is not nowadays. You cannot say that the Wardboy is not there. So now you have once it is uploaded, it is shown to your mobile or your iPad, where you can just click and see what the report is. Even if you want to see the all print plates, that is also available digitally. So you can see all the plates, and you can change the contrast and all. So that is possible. So that can be done with the digital records.
Definitely. Any words for AI?
Before coming to it, the advantage, the biggest advantage practically what we found in integration is refer notes.
Yes.
Sometimes patient has been referred from somewhere else, some other hospital. They are getting some documents, reports, radiology reports, or even prescription. What happens in emergency department, we are focusing on patient care only. So we forget to read what has happened in the past, what has been written in the refer note. So all this document can be uploaded in the system.
Definitely.
So after 1 year also patient comes, or some insurance claim, or some medical legal issue later on, we can refer the past record also, and you can save a lot of energy and time at that time. That is the biggest advantage in digital.
Surely.
Regarding AI integration, yes, we tried in our hospital, but it has been refused by the system, saying that it will leak our data. We
That is
cannot
correct.
rely on AI
Yeah,
right
so
now.
That is very correct. But with AI, we can check the drug-drug interaction. We can integrate checklist. Like you write the diagnosis of community-acquired pneumonia, it will give you a flow chart, what antibiotics to choose and what reports to send. We can have medical calculators on board, bundle care for nursing, and dosage calculator as per GFR, everything digital. Next, we will check the flexibility, how the system should be flexible enough. Obviously, it should be flexible enough to accommodate the changes which we have discussed in the last section, as well as losing the reliability. That is the most important thing. And it should be flexible enough to user-friendly for everyone and easy implementation. Anything from the panel?
Okay, regarding writing notes in a digital format, it will take a lot of time.
Definitely.
If you are not well versed with the typing and everything. So what happens, you can use the take a help of AI in that case.
Okay. So we can just
So
speak
that
and it will write for
whatever
ourselves.
we speak, even the format in a modified language, that is easily understandable to everyone, whoever is read.
Sure.
So again, that is one help. But again, AI, I don't know right now why the system is not allowing some security issues or whatever.
Yes, sir. Because whole data has to go on internet, so synthesize out of it. So that's why AI is not able.
Even we can record the monitors screens so that will
Yes.
automatically chart here the nursing work.
Definitely.
So
We can
that
just
will
raise
reduce
the
nursing
tablet or
workload.
phone and click the photo of the vital monitor to get all the data in the vital chart.
I think also we should have flexibility of accessing data through any device, like through the different, from anywhere we should be able to log in, or like sir said, to the referring doctor, we can send it for the, writing notes or even changing notes when required.
Surely. So whenever you are referring to any consultant, we can just share the patient's notes. It will directly come to the consultant's mobile and no need to come to the hospital to review the reports. Now the last segment, affordability. How we make the electronic documentation system most affordable. It should be affordable enough to buy, run and maintain it.
I think overall in a reasonably big setup, if we compare, like Dr. Kronal said before, that we need a space for storage. We have to maintain that storage space. So to overcome that all headache, this digital record system will be comparatively, I think, better to maintain than having, maintenance of space and everything.
So basically it saves money when we are not using paper, because one paper comes per 1 rupee per paper, but at the same time we need to spend on the devices and we need to spend on cloud storage.
Even we have to maintain that staff to maintain this documentation and all. So you require more staff for that. If it is digitally, you require less staff.
Definitely. So what my model is, we can use the available resources to make our ICU digital. Uber never invented taxis. They don't hire or buy taxis or hire drivers. GPS is not invented by Uber. Uber just organized all things to use for a specific purpose, and that's how we are supposed to do it, to make this thing more affordable. And one last thing, this is the last slide, that good EMR is not picture based. It should be always true digital. You should be analyzed data digitally. Anything you want to add, Dr. Kunal or Dr. Samir sir or Dr. Amit?
Just because short of time, just highlight what problems we are facing. First thing is the authentication. Whatever data has been entered by resident or fellow or whoever is writing, who will authenticate it? That it has been told by you, it has been written by you. So in paper, we usually sign.
Yeah.
But in electronic, it is very difficult unless you log in and log out from your account, which is very difficult for each and every patient. Second thing, the records, which the security, because anyone can in the hospital can access it, even nurses, doctors. So patient confidentiality, that is a big threat, because all the records, all the reports, everyone can see in the hospital. So that is the second issue. The third one is writing a note. Usually what we see, daily to repeat the same thing it is a little headache. So what resident and nurse or even the fellows do it, they copy paste. Whatever written today, the same thing will be copy paste tomorrow.
Yes, next day, yeah.
So these are the practical issues we are facing, and as time goes, we'll try to rectify it. Fourth biggest thing is I should not name the specialty, but many specialties are reluctant, still not using the electronic record. આ બધું ના હોય એમ. અમે તો પહેલાં પેપરમાં લખતા હતા, અમારે તો આવું જ ફાવે.
Yes, yes.
So that is another problem. All specialties, all doctors will not accept it to write it digitally in a daily basis.
Definitely. Dr. Krunar, you want to add something?
But I think this is the future.
Yeah,
So
yeah.
as we told in the question of when, so early is better, because in future you have to do it. So if you do it early, your learning curve will cut down fast.
Yes, yes.
So it should be done, and that is what just the slide shows. The thing is, true. It should be true digital,
Yes.
because just writing a note and keeping the post of it, it is not the thing. It should be true digital. Whenever you need to analyze, you need to recover. It should be come with just a sake of words.
Definitely. So
Thank
this
you.
is the last slide. It is a routine scenario, routine day in our ICU when we take handover. A handover of the ICU tablet pen, handover of the tablets before few of got missing, and the charger is now mandatory. Many a times it happens when we are writing a note, the tablet is discharged and etc. So these are the new challenges. This is how we adapted. And this is the concluding side. Affordability, reliability, efficiency, and flexibility decides your ICU documentation system. Risk-benefit ratio has to be calculated. It is better not to install than to install a substandard software. Otherwise, you will get trapped. It has to be upgradable. Safety and security of your patient's data is mandatory, and it should not cause any problem in the accreditation. My talk is concluded. I am very privileged to share the stage with my teacher, Dr. Samir Patel sir, and present in front of my teacher, Dr. Kishore Viradia.
Udgit, one thing to add that in last side, here, chairpersons. That is, see, we have to follow some accreditation, because the era will come where almost 90% patients are cashless. And these insurance companies, they always go for some accreditation. If your hospital is NABH accredited, then they will faith on the hospital. So while making the software, you should follow the norms for NABH. If it is laboratory, it should be NABL or some ISO certification, or they are having their norms for the data collection and data maintenance. So that particular thing also we should keep in mind when we are doing a software update or something.
Surely, sir. We are using it in our hospital, and it is already NABH accredited. It doesn't cause any problem. Format like PDF, and this is the future. So everyone has to adapt it, including the accreditation bodies. I think we can conclude.
Thank
Thanks
you.
a lot. Thank you.